Good evening all. Today I am going to discuss about cellular adaptations in growth and differentiation. So there are totally five types: atrophy, hypertrophy, hyperplasia, neoplasia, metaplasia and dysplasia. So now let us see one by one in detail. So if you take hypertrophy is nothing but, as the name indicates, it refers to increase in cell size without increase in cell number. So why the cell size increases is due to the accumulation of proteins or due to any assembly of intracellular structural components of the cell, and the constant number of myofilaments too increases, and the cells which cannot multiply in our body or muscles in bodybuilders and cardiac muscle in hypertension. You know, cardiac muscle never multiplies, and muscles in bodybuilders also usually don't multiply. So those who go to gym and those who do not go to gym, the difference is that due to vigorous physical activity, the muscles in bodybuilders, if you see, it will be hypertrophied so that they get strong biceps and triceps. Next, and a bigger one. Next, let us discuss about how myocardial hypertrophy occurs. Okay, so this is the mechanism of myocardial hypertrophy. So due to increased workload, the mechanical stress, the cardiac muscle is stretched. Okay, so what happens is, uh, certain mechanical sensors are there. This will integrate to directly increased workload, and these sensors, what they will do is it will activate a complex. Okay, there are a few a number of signaling pathways which include inositide 3 kinase pathway and other G protein coupled receptor initiated pathways, and there is also stimulation of increased production of growth factors like TGF beta and all, and then if we take, there are even other pathways that will activate transcription factors as GATA4 and NFAT. In NFAT, the nuclear factor of activated T cells is there, and myocyte enhanced factor, that is MEF2. So all these are transcription factors. They will increase the expression of gene that will encode more muscle proteins. So what happens is, due to these transcription factors, there is an induction of embryonic or fetal genes. So due to this induction and synthesis of more concentrated proteins and production of more growth factors, due to the increased activity of gene expression of given by transcription factors, it leads to increased mechanical performance and increased workload. And this growth factor, if you take as an example, is IGF-1. IGF-1 is nothing but insulin like growth factor 1. Okay, this gets stimulated. As a result, the cardiac muscle gets hypertrophy. This is simple mechanism of myocardial hypertrophy. Okay, next hyperplasia is nothing but increase in number of cells in response to stimulus. So there are actually, in hyperplasia there are physiologic and pathologic hyperplasia, but similarly even in hypertrophy there is pathologic hypertrophy and physiologic hypertrophy. In pathologic hypertrophy, heart muscle and skeletal muscles will have a limited capacity for division. Okay, so due to that, they respond to increased metabolic demands by undergoing directly hypertrophy. So the most common stimulus for hypertrophy of skeletal and cardiac muscles is nothing but increased workload, as I discussed earlier, which results in synthesizing more protein, more myofilaments per cell. All these contribute to pathologic hypertrophy. In physiologic hypertrophy, there is a massive physiologic growth of uterus during pregnancy. Okay, it is due to hormone-induced enlargement of an organ that results mainly from hypertrophy of smooth muscle. In pathologic hypertrophy, we have seen hypertrophy in skeletal and cardiac muscles. In physiologic hypertrophy, we have seen enlargement of growth of uterus due to hormone-induced enlargement of the organ, and it results mainly from hypertrophy of smooth muscle fibers. As you all know that the myometrium of uterus is a smooth muscle. So uterine hypertrophy during pregnancy is stimulated by estrogen hormone signaling through estrogen receptors. Okay, that you have to remember. Next, similarly, in hyperplasia, we have physiologic and pathologic hyperplasia. In physiologic hyperplasia, in female breast during pregnancy, there is a proliferation of glandular epithelium at puberty. Okay, hyperplasia. So, development of breast is a hyperplasial phenomenon, and is usually associated with enlargement of glandular epithelial cells. Okay, so example of compensatory hyperplasia is from the liver. That is, for liver, it is a compensatory hyperplasia. This concept is developed like the individuals who donate one lobe of liver for transplantation will need not the individual need not donate whole organ. Okay, only one lobe of liver is donated, and the remaining cells will proliferate and liver soon goes back to solid. This is what liver regeneration. And also, if you take bone marrow has the high capacity to undergo rapid hyperplasia. So, if there is deficiency of mature blood cells, will undergo a rapid hyperplasia. Okay. Next, endometrium. See, after menstruation, the endometrium is removed. Endometrium layer is removed after menstrual cycle occurs. Okay, so that's an example of hyperplasia. That is what in endometrium in pathology condition. What happens is the proliferative activity of endometrium is stimulated by pituitary hormones and ovarian estrogen. Okay, so due to pituitary regulated by regulation of pituitary hormones and ovarian estrogen over the endometrium, it is controlled. Its hyperplasia phenomenon is controlled, but however the balance between the estrogen and progesterone system resulting in increased amount of estrogen which will stimulate hyperplasia. Okay, it is a common example of abnormal uterine bleeding. That is why it comes under pathologic. Okay, then increased cell division along with hyperplasia elevates the risk of the chances of inheriting the genetic aberrations and unrestrained proliferation and cancer. So that is what also mentioned, and also patients with hyperplasia of endometrium are at increased risk for developing endometrial cancer. Actually, we have seen that uterus before ovulation during pregnancy becomes thick. That is physiologic hypertrophy. Pathologic hypertrophy leads to uterine bleeding, and excessive hyperplasia may result in benign prostatic hyperplasia and also other diseases. So the patient's hyperplasia of endometrium are at high risk for developing endometrial cancer. It forms a cancer actually, and also it causes uterine bleeding in some cases. So, let us discuss about benign prostatic hyperplasia. In benign prostatic hyperplasia, what happens is there is an increased cell division associated with increased cell division due to hormone regulation by androgens. That is what benign prostatic hyperplasia refers to. Okay. But in the absence of androgen, benign prostatic hyperplasia can be controlled. Next, let us see about mechanisms of hyperplasia. See, hyperplasia is due to the growth factor driven proliferation of mature cells and increased output of new cells from tissue stem cells. Okay, that is what mechanism of hyperplasia occurs due to these two factors human enough. Next, let us go to atrophy. Atrophy, as the name indicates, it is opposite to hypertrophy, that is reduction in size of the organ or tissue due to decrease in cell size and number, both decrease in cell size and number. Okay, so that is needed. And then next is uh, uh, next is atrophy. After atrophy, we will see about pathologic atrophy. Okay, physiologic atrophy we will see first. Okay, physiologic atrophy. The best example is notochord. See, notochord will degenerate, okay, and it gets connected to the vertebral column during embryogenesis, all knows that. And even thyroglossal duct will undergo atrophy after the development of fetus, okay. After parturition, a decrease in size of uterus also may occur. Not that much decrease in size, but some decrease in uterus mass will occur after parturition, okay. So that is needed. And then we will discuss about pathologic atrophy. Pathologic atrophy, there is a decreased workload. Due to decreased workload, this is disease atrophy. So if you take a fracture, bone, it is cannot be easily moved, okay. It is made at resting position in a plaster cast, or when the patient is in continuous bed without any activity, and continuous bed rest will lead to skeletal muscle atrophy. That is why physical activity is needed to prevent the atrophy of skeletal muscles. And also there is a denervation atrophy. We will come to it later. Before that, due to that, the decrease in cell size is skeletal muscle fibers will decrease in number, and cell size also decreases, but it can be reversible injury. It is a reversible injury. It can be increased again when you do physical activity. Next, loss of innervation. If you take loss of innervation due to denervation atrophy, so the skeletal muscle function is dependent on nervous system. Okay, if the damage to nerve leads damage to the nervous system will lead definitely to atrophy of the muscle fibers. And if you take the due to diminished blood supply, okay, diminished blood supply is an ischemic or atrophy or senile atrophy. So what happens is, due to decrease in blood supply, it will start developing arterial occlusive disease, which results in tissue atrophy. Next, due to inadequate nutrition, we will get cachexia and marasmus. These two diseases are common due to inadequate nutrition. And what happens is, due to there is a protein malnutrition diseases, due to decrease in protein content in our diet, it will cause utilization to meet the body's demand and metabolic requirements. It will cause utilization of skeletal muscle proteins as a source of energy. So the proteins that are present in muscles are consumed, okay, to produce energy, okay. And the adipose tissue stores are also depleted, so it results in muscle wasting, that is cachexia, okay. So chronic overproduction of TNF, tumor necrosis factor, is responsible for appetite suppression and lipid depletion, which leads to muscle atrophy. So that is important. And then next, next is after inadequate nutrition, it is loss of endocrine stimulation. So after menopause, best example is breast and reproductive organs are directly dependent on endocrine stimulation for its metabolism and function. But if there is a loss of estrogen stimulation after menopause, if there is no estrogen stimulation, it will result in atrophy of endometrium. We need increased level of estrogen after menopause, so that what happens, again endometrium layer will proliferate. This proliferative phase is arrested due to loss of estrogen stimulation, and it leads to atrophy of endometrium, vaginal epithelium and breast. That is what loss of endocrine stimulation will lead to. So especially the breast example, it is coming in many cases. Even in hyperplasia it is coming, even in hypertrophy also it is coming, so it is very important. Then if you take pressure atrophy, see, if you compress tissue for some time, it will cause atrophy. Why? Because a benign tumor, enlarging benign tumor can cause atrophy, and this atrophy setting is probably due to result of ischemic changes. If you compress the tissue, the blood supply to the tissue decreases and causes ischemic changes. So that should be noted. Okay, and then let us see the mechanisms of atrophy. There are two mechanisms that decrease protein synthesis and increase protein degradation, and this increased protein degradation is brought about through proteosomes. That's all you can remember. Next, let us see what is metaplasia. See, metaplasia is a reversible change. Okay, it is a very important reversible change in which one differentiated cell type, whether epithelial or mesenchymal cell, is replaced by another differentiated cell. So one type of cell is replaced by another differentiated cell type. Okay, so one mature cell is replaced by another mature cell. So the influences that predispose metaplasia is persistent will initiate make malignant transformation in metaplastic epithelium. It causes cancer, malignant transformation in metaplastic epithelium. The mechanism is reprogramming of stem cells that are known to exist in normal tissues. That is what the mechanism. So let us see in detail about metaplasia. So metaplasia is nothing but a type of cell, specific type of cell is replaced by another specific type of cells. So let us see the examples. In respiratory tract, what happens is due to chronic irritation, that's in a smoker. If you take a cigarette smoker, the ciliated columnar epithelial cells of trachea and bronchi are often replaced with stratified squamous epithelial cells. There is no cilia, and instead of it is columnar cells, it is replaced by squamous cells. So vitamin E deficiency will directly cause squamous metaplasia in respiratory epithelium. Okay, which has highly toxic effects on vision. Okay, so this is the example of metaplasia, and another example is stones in excretory ducts of salivary glands, pancreas, and bile ducts will lead to squamous metaplasia in their duct. Okay, and then in respiratory tract, that is what important. The mucus secretion ciliary action is lost. So what happens is only colonal cells are secretory cells. Stratified squamous cells do not secrete. They don't have secretory function. They have only protective function. But in trachea, we need some secretion, mucus secretion. Okay, so the dust particles are trapped, but these are lost, and so it causes harmful effects in our respiratory system. And also it causes the development of squamous cell carcinoma in areas of the lungs. That is nothing but the coronal cells are replaced by squamous epithelium. Okay, so that is an important example, and you can remember the mechanism of metaplasia. Metaplasia example is metaplasia mechanism. Mechanism is reprogramming of stem cells that are known to exist in normal tissues. That is what we can do. Okay, that is we need to check the reprogramming of local tissue stem cells that are present in our body. So how these changes are stimulated is, these changes are generated by cytokines, growth factor, and extracellular matrix components in the cell's environment. See, if we take stem cell reprogramming, we want these external stimuli to make the expression of genes that will move the cell towards specific differentiation pathway. So that is what we needed. Next, receiver intracellular accumulation in the next video, and with this the chapter comes to the end. No, we have another topic, cellular aging. Two topics are pending, so that we will be dealing it in next video. Thank you.